I'm Eleanor Czaplinski. I am the head of breast medical oncology at Valley Mount Sinai Comprehensive Cancer Care.
Hi, my name is Carrie Ann Abbott. I'm a cardiologist at the Valley Health Center.
And today we're here to talk a little bit about Valley's Cardio-Oncology program. So what is Valley's Cardio-Oncology program?
Valley's Cardio-Oncology program is a collaborative effort between the oncologist at the Valley Health Center as well as the cardiologist. Our goal is to comprehensively take care of people who are being treated for cancer. So we want to make sure that not only do they do well from an oncology standpoint, but we keep the rest of their body healthy as well.
And who is eligible for this program?
So we cast a wide net. We see people who are being actively treated for cancer, so people who are receiving chemotherapy, but also people who've had cancer treatments in the past that have side effects that could cause some cardiac complications, people who've had radiation to their chest, for example, people who've had anthracycline chemotherapy. We want to make sure that we prevent any complications that can arise from those treatments.
And I think it's important to stress that while we have some guidelines, really anybody who's been treated for cancer is eligible to see a cardiologist in our program.
So does Valley's Cardio-Oncology program complement the role of the patient's referring provider?
I think it's important to stress that the majority of the patients referred to cardio-oncology are going to be coming from oncologists. And oncologists, I always say that you are not going to get everything that you need from your oncologist. We have a multidisciplinary team, and that includes cardiology as well. And as an oncologist, I can recognize that the drugs that I'm giving increase someone's cardiovascular risk, but I don't have the expertise to prescribe the medications and to monitor the heart as well as you do. And so that's where it really becomes this complementary and multidisciplinary team that is really designed to give the patient everything that they need.
And I think we also have to recognize that when a patient comes in to see you for an oncology appointment, there's a lot of questions, a lot of side effects that you need to discuss with them, and there's just not enough time in the visit to also discuss their cardiac risk. So it's nice to just have a separate appointment where they can focus on the cardiac piece of things and ask questions in that domain. And what are the benefits for patients who participate in the cardio-oncology program?
I think the number one benefit, and I see this every single day in practice, is that, as you mentioned, there's so many things to discuss. And we talk about the fact that the medications can increase cardiovascular risk. A lot of times patients complete their chemotherapy and then they're on long-term maintenance medications that can also increase their risk. And sometimes with everything else going on, that kind of doesn't get, it's not at the center. And so very often we're focusing on treating their cancer, but we also need to be focusing on their blood pressure and their cholesterol and modifying their cardiovascular risk. And so having this dedicated program run by specialists who understand oncology, who understand the risks that these individual medications have, and then can take all of that information and come up with a personalized treatment plan, that is really an incredible resource that they're not getting outside of this program.
I think it's also good to reassure patients when they hear that they're going to be receiving medicines that could cause cardiac complications. It's scary, but to reassure patients that we're going to be keeping close eyes on them. We'll monitor their heart very closely. And if we are to see subtle changes in the heart, we can initiate cardiac strengthening therapy and keep them on their cancer treatment so they can get the best possible outcome.
And the cardio-oncology program actually lives at the cancer center. And this is huge because we are down the hall from each other and we can collaborate, we can talk about patients, and patients love it because they don't have to go yet to another building and learn a new facility. Everything is in one place.
I agree. How can patients be referred to the cardio-oncology program?
So patients can ask about it, they can self-initiate a referral, but the other way is for our oncology team members to make that referral. And also those referrals can come not just from oncology or cardiology, but they can come from primary care or other specialists or other members of that patient's medical team. And I think we really want to be inclusive and welcome everyone who feels that they would benefit.
I think you bring up a great point that people do well with their cancer therapy and sometimes they try to move on and put that part of their life behind them. But I think we have to keep in mind that there's still risk that remains even when their cancer treatment is finished. And we want to make sure that we're not missing an opportunity to prevent any cardiac complications down the road.